I rode to Surmang for the first time in the cab of a blue truck. It's 120 kilometers from the nearest decent-sized town to the clinic, and the trip took 17 hours. We made pretty good time. At dawn we stopped for yak butter tea and noodles at a black yakskin tent pitched on the grasslands below Mount Gula. Surmang is a beautiful place. Morning fog has yet to lift from the valley. I know close to nothing about medicine. When I had free time in the afternoons, sometimes I watched the doctors see patients. No one seemed to mind. Confidentiality simply wasn't an issue. Here, Deb Maig, a doctor from Minneapolis, and Sonam Droga check a patient's bum leg. Droga was always hunched over her desk. She wrote down the patient's name, village, age, gender, medical history. One night in late September, Punsuk and I woke to the sound of shouting in the yard. A logging truck had had an accident on the road somewhere near the border of the TAR, and a log had crushed a man's leg. Punsuk left on his motorcycle, reset and splinted the man's leg. Sometimes patients had mysterious symptoms. This monk was weak but not paralyzed. He stayed in the patient observation room for about 3 weeks. Punsuk carved a wooden bar and hung it from the rafters so the monk could lift himself up in bed and strengthen his arms. Thinking back, there were lots of puzzling cases. This nun came to the clinic in September with her mother. Her mother told Droga the case history: a miscarriage followed by a slow loss of motor skills and speechlessness. I sat on the lawn with both of them and watched as Droga took the nun's blood pressure. Boni, a Chinese consultant from Guizhou province, and Suchen, a Tibetan whose father grew up in the village, worked together throughout the summer, surveying the health needs in the valley. They spent most of their time interviewing villagers, village heads, Tibetan traditional medicine doctors, truckers, and lamas. Suchen had lots of extended family throughout the valley. One of his relatives, Aga, works as a Tibetan traditional medicine doctor in Soge, a village that borders the Tibet Autonomous Region. Chinese brought Western medicine to the valley in the 1960s, but traditional medicine doctors like Aga have been practicing for centuries, using techniques like urine and pulse reading to diagnose and treat patients. Local doctors like Aga often referred patients to the clinic, and vice versa. One afternoon, the village head of Soge called all the villagers together so Boni and Suchen could talk to them about local health problems and community needs. They brought down construction paper and blue markers, and the villagers gathered in a small meadow by the river to draw pictures of their problems. This is what their problems looked like: a horse grazing, a road, a person on an operating table, a white stupa, a barley field, a book, a fire, and a bridge. They ranked these by making hash marks with a red marker. For them, rebuilding the Dutsitil monastery, shown here as a white stupa, was most important. Next came having a place for small operations. Third was recovering grazing land lost to the TAR when the government established the border. Their health problems looked like this: a knee for arthritis, a stomach, and a lump in the neck for cancer. They also drew eyes, teeth, and skin. Throughout the summer, Boni and Suchen posted these charts on the walls in the kitchen, and we met after dinner to talk about them. I was the project manager. In July, I met with the director of the Prefecture Health Bureau to talk about our plans for the summer. In August, Li came to Yushu and signed a memorandum of understanding with the Health Bureau, firming up our collaboration for the next several years. In September, doctors representing the Foundation came from Vancouver and Lhasa to examine patients who had performed cataract surgeries a year earlier. They stayed at the clinic for 2 nights and reported that 9 of every 10 patients enjoyed improved vision. The local Tibetans found the whole thing miraculous, and a rumor spread as far as Chamdo in the TAR that we could cure the blind. When patients can't make it to the clinic, the doctors go out on house calls. Tashi Droma was 88 years old and lived in the village of Redja, about 3 kilometers up the road. One afternoon, Deb Meg visited her at home for a checkup. The widows who live in Redja are among the poorest people in Surmang. Every year, the foundation donates food and clothing to help them get through the winter. Objin works as a Tibetan language teacher during the school year and as a medical interpreter for the foundation in the summers. He can write in 3 languages, Tibetan, Chinese, and English, and he helped Anna, a postnatal care specialist from the Netherlands, translate a handbook on safe birthing practices into Tibetan. Every year, foreign doctors volunteer in Surmang. Sometimes they bring their spouses. Dr. Deb Meg brought her husband Bill. Bill was an investment banker and helped me manage the money. He was also a great cook, a handyman, and a mandolin player. It was a busy summer for all of us, but we made time to enjoy ourselves. In late August, Bill and I took an afternoon off to play frisbee golf. We played all the way to the village of Redra, and when the wind picked up, we carried the frisbee and walked home. I'm not sure what these kids do every day, since there aren't any schools in the valley. On Sundays, when Droga and I walked down to visit her uncle in Mode, we'd see them playing in the barley fields by the road. Droga woke every morning to walk in circles around a little red temple. Inside the temple, a great prayer wheel hung from the ceiling, filled with paper prayers. In the morning, I'd instant coffee and watched Droga walk in circles. I also watched the fog lifting over the valley. There was a lot more going on in that valley than you could ever really understand.